Okay, so our next speaker, Dr. Luis Arrondo, is a cum laude graduate of Parker University of Chiropractic. He has worked with Stanford Medical University's Family Medicine Core Clerkship Program to help Stanford medical students learn more about alternative healing approaches when they visit his clinic. He developed his expansive multidisciplinary view of health and the body's innate ability to heal by traveling and practicing in the United States and Italy. He's a certified neurochemistry and nutrition graduate from the American College of Functional Neurology, has served as a state certified qualified medical examiner, and as a fellow of the Academy of Forensic and Individual Chiropractic Consultants. Has been certified in the neuro-emotional technique. And he'll be talking to us about Wolves Gardens and chocolate and health overall. Please welcome Luis.
A few years ago, I was wondering to myself, I think I'd like to write a book, but with so many great health books out there, is there anything I could really contribute? And I thought, but if I write a book, I want to put chocolate in the title. And I want to make it relevant, because I teach people how to eat chocolate to lose weight, among other things. And that's one reason why the word chocolate is in the title. When I started practicing, I had an interesting experience, one that really molded how I was going to look at patients and their health in a sense that took it beyond the usual functional medicine, nutrition, exercise, lifestyle, and diet. I remember, because I've lived in 5 countries. I've had the fortune of speaking 3 different languages. I've worked now in 10 countries. And I've met a wide variety of people, not just doing clinical work with them, but I have a deep interest in interpersonal dynamic growth. So at a very deep level, I was able to talk to people from different countries, different cultures, and different languages. And I was struck by how different they were, yet at the same time, in essence, how similar we all are. And I began to look for patterns behind patterns. And that forms the basis of this book, Wolves, Gardens, and Chocolate. So in the middle 90s, I was living in and working in a small island, a couple hours by flight from Rome, which I also lived and worked in. I went back and forth. And that was the island of Sardinia. And in Sardinia, I lived in the northern coast in a small town, a sleepy small town. And as some of you or most of you may know, during the afternoon between 1 and 4, everything closes. I mean, everything closes. It was a shock to me because I was coming from the US, and I wanted to buy a postage stamp to send, a card, a postage card to my grandmother. That's not going to happen. A pen, that wasn't going to happen. So I either ate pasta and enjoyed myself and walked around and waited till 4 o'clock when things opened, and then when our clinic got going again. So but one day I walked into this museum. And here in Sardinia, up in this northern corner of Sardinia, of all places, they had a museum that was dedicated to Peruvian culture and history. And I was saying, this is fascinating. And I was looking through it. And as a clinician, the thing that struck me was this. I got to an area where they were talking about the healers of ancient Peru. And they were talking about the source of all diseases. And they called it el susto, which speaking Spanish, I knew what that means. I know what that means. El susto. And that was the source, they said, of every single disease. El susto in Spanish means fear. Fear. So to them, an emotion was the beginning of illnesses. And that got me to thinking, well, that's interesting. And I just stored it in the back of my mind, and I went back to work. But as time went by, and people came in, and we discussed their problems, and I listened to them, I examined them, and then rather than going into the usual, okay, now step B, step C, in clinical sequence, I just talk to them. I'm curious by nature. I wanted to know what life experiences, not just lifestyle, what life experiences may have shaped the issues and conditions and illnesses they were bringing with. So I asked him, listen, around the time you had whatever they may have had, I said, what was going on in your life when that started 10 years ago, 15 years ago, 2 years ago? What was happening a year or two before? And then I started seeing these connections. Some of the connections were cellular, some were biological, in the sense that they were soft tissue related, some were biomechanical, some were emotional, psychosocial, and some were spiritual. A lot of these connections, the patients themselves weren't even aware of. Not until I started asking questions and we started engaging in dialogue. And I began to realize, as I heard what they were telling me, was how important for us to really get to the depth of healing, to look at ourselves at every single level, to look at the four corners of our house of well-being, the physical, the emotional, the mental, the spiritual. I'll give you a couple of examples on that. About a year and a half ago, I walked into an exam room, and there's a new patient, and he's about 50 years old. And we started trying to talk, but I couldn't understand him because he spoke in such a hoarse voice I could barely make him out. So I had to get really close to him, and he would, tell me what's going on. And his main concern was, he says, I can barely talk. They can barely hear me. And this was very frustrating for me and anguishing to him because he says, at dinner time, my family cannot hear me. And this has been going on for about a year, and I thought, well, I'm not a specialist at this, laryngologist, ear, nose, and throat specialist. But he already done that. He says, they cleared me, I'm fine. So I said, well, what's been going on in your life? What's been going on in the last couple of years? I says, and when this began to happen, what was taking place in your life that may have caused this stress or trauma? And he reflected, he said, I got really angry at my daughter for something she did. I don't approve of some of her behavior. And at dinner time, I shouted at her. And I said, and shortly after that, that's when it became hoarse. So that's interesting. And I said, do you think there's a connection? He says, I don't know. But now that you ask, I wonder, right? So he says, So we kept talking a little bit more, and I asked him more about himself. And he's a very deeply religious man. And so I said, let's do this. Because you've already gone through all the exams, the tests, the specialists. We found a passage in the Bible, he's a Christian, that focuses on compassion and tolerance. And I said, would you read this passage out loud every day at night? It's an exercise for your throat, but it will also help you internally. And he began to do that. He came back 2 weeks later, and I could hear his voice had improved. I didn't do anything. I didn't give him a pill. I didn't do anything. Just talked to him. And then and he was happy about that, but the voice was still kind of weak. And I said, would you consider talking to your daughter and asking for her forgiveness and giving yourself the permission to forgive yourself for what you've gone through and for being upset and so judgmental at her? And by then he softened up because he's a pretty tough guy. He says, I can do that. He came back 3 weeks after that. He continued doing the same exercises of reading from the Bible. And now he says, now look for passages with forgiveness. So he read out loud passages on forgiveness. He came back and he says, in a pretty clear voice, he says, I spoke to my daughter. And he was very happy, almost radiant. He says, my voice is coming back. He says, my family can understand me at dinner time. And they've told me that some of the time I speak with a completely normal voice. Now, his voice wasn't 100%. And that's as good as we got for a while. But he was very happy with that. The ability for him to connect with, to forgive himself, to open up to compassion, and to engage with his daughter created a healing that no functional medicine, no pill, no therapy could ever do. I had another woman about a year ago come in, and I walk into the room, and you ever meet patients, just people, and there's a cloud of sadness around them? I mean, it's about this far, right? You just go, oh, it's raining here, You just feel it. And, and this is this woman sitting on this table like this. And she was barely breathing, you know. So we started talking, and she had a number of issues. And she said, you know, the thing that really drives me, that I want to get help with, is this saliva. I'm having this constant salivary flow, and I can't stop it. I carry a handkerchief around. It's embarrassing. I don't know what to do about it. And, you know, as clinicians, you think of parotid glands, sublingual glands, submaxillary glands, or who knows, right? And I'm saying, well, there's tests you can do and a specialist to see. And so we started talking to the sadness. Then I had a nudge. You know, do me a favor, tell me about your family. Because you've been having this for a couple of years. So tell me a little bit about your family. And, you know, I hadn't seen her smile for these 20 minutes. And she still wasn't smiling when I asked her about her family. She says, I have 3 sons. One of them died in a car accident 2 years ago. And I said, that must have been very hard. She said, the day he cried, the day he died, I never cried. And then she says, but the day he died is the day my saliva started running. And I asked her, do you think there's a connection? Is it possible that you are crying through your mouth instead of your eyes? So we talked some more, and I said, you know, why don't you try this? And this is something I give to people. There's research on this, helps with rheumatoid arthritis. And there's just recent research that came out on this about 2 or 3 months ago in expressive writing. I asked her for 20 minutes a day, if you're okay with this, and I'm not a psychologist, so this is not psychological counseling, but I'd like you to close yourself in your room, and for 20 minutes a day, I'd like you to do this. I'd like you to take a pen and a paper, and I want you to start with a sentence. The day my son died, I felt. And what I'd like you to do is start writing, and use your cell phone to time yourself. Don't take the pen off the paper, have a few sheets. This is about letting it flow. It's not about thinking. And whatever comes up is whatever comes up. At the end of 20 minutes, what you wrote is private to you. Don't show it to me, don't show it to anybody else. Rip it up and flush it down the toilet. And I want you to do that 3 days in a row. And I'll see you in 2 weeks' time. She comes back in 2 weeks' time. I walk in, and I go, she's got a beautiful smile. She's got beautiful teeth. She looked at me, she was smiling. And we started talking. He says, how did it go? She says, I did it. He says, and it was hard. He says, doctor, I cried. I cried all 3 days. But now, I no longer have my saliva coming out. In fact, sometimes, guess what? And then she smiles again. My throat is a little dry. She allowed herself to connect with her grief, and in doing that, the healing began. There are a lot of people who are not connected with those 4 walls or those 4 corners of healing. The spiritual, but the mental, the emotional, and the physical. And when those are missing, we don't have the foundation to have the roof of health and the roof of well-being in our lives. There's a term used, and it's a medical term. It's called alexithymia. I don't know if you've ever heard of it. Next time you go to San Francisco, because you know how we live in the Bay Area, so we have, you know, family coming over or friends coming. Oh, you got to take me, you know. So we take them with a cable car. Next time you're driving a cable car up Powell, up Hyde, glance at the municipal driver. There's interesting research done. San Francisco municipal drivers that repress their emotions tend to have greater bouts of low back pain. And the more they repress their emotions, the more often they have low back pain. There's a study done with over 1,100 of them. This is the study. I'm showing this study. It's called Difficulties Perceiving and Expressing Emotions Associated with Low Back Pain, the relationship between lack of emotional awareness, alexithymia, and 12-month prevalence of low back pain in 1,180 urban public transit operators. It was done here in San Francisco. By the way, I'm showing you this slide with the research, but I don't want to slow things down by showing you slide after slide of research. So what I've done is this. The book is titled Wolves, Gardens, and Chocolate, and that's the book page. If you go to it, if you're not up for reading a book, I have references by chapter. My book has 900 citations. I've given them all on there. You just go to the citations and find it. I also have an index and a table of contents. So if you want to match one thing to the other, look at the table of contents, see what chapter it is, and you'll find the research there. If I speak about statistics, and I will during the rest of this talk, and I don't show the slides, in order to keep the flow going, you just know where to go. wolfsgardenschocolate.com. And if I don't have it there, I'll show it here. A woman comes in with her son, and she's got gastritis. 12-year-old's got headaches. So what's a common orthodox approach? Well, proton pump inhibitors, for her, maybe triptans, or Tylenol for the son for the headaches, right? And in fact, that's what she was on. And it helped her symptoms. She says, no, we both feel better. But I don't want something that has these type of side effects or can, I want something natural. So I said, well, there's always, licorice. There's also, for you, there might be, marshmallow extract. For your son, there's feverfew, magnesium. But then I started asking her some more questions. So when did it start? What's been going on, et cetera? And we got into a dialogue. And it turns out that she has a hard-working husband who's also a hard-driving husband. Type A personality, strong, fit as an ox, never been sick a day in his life. And it's his way or the wrong way. And at home, he lets them know that. And they feel the stress of it. So really what ends up happening is the cause of the problem isn't a lack of magnesium or marshmallow root extract, right? It's the husband. But the husband is fit as a fiddle and feels great. But in that family, that nucleus of family, they're the ones carrying the symptoms for him. They're the ones with the medical prescriptions, right? They're the ones who are suffering. Because he has not connected with his inner self enough to allow himself to feel a compassion and tolerance for those who may not be as strong, or may not have the gifts he may have to go through life the way he does. I'm going to talk a little bit more about that later on. When I see things like this, especially a man like that, it reminds me of what Carl Jung said. He said, show me a sane man, and I will cure him for you. Yeah. So, what does being healthy really mean? And what does being ill really mean in the broadest sense of the word? Was this man healthy? Was their mother and the son ill? Can illness, can symptoms be a sign, a guidepost towards better health? Towards being well? Because he may have been in good health, but we would say he was being well? No, he wasn't in a state of well-being. I saw a woman about 6 months ago who came in, and she came in like this. And she sat down, we started talking, and she says, I got left arm pain. And I love working with shoulders. I love working with extremities. As a chiropractor, it's one of the things I have. It's a lot of times it's pretty easy to work with and fun. So I said, okay, well, we'll take a look at it. So I examined her and asked her some questions. Well, it says, I can't do much of it. In fact, I'm no longer working. And I was surprised to find everything moved really well. I says, not only does your shoulder move well, but when we talk about connections, little known connections, go back to here. In the body, I see these biochemical, biomechanical connections as well. A lot of times I see chronic shoulder problems where I don't touch the shoulder. I may work on the occiput relationship, the cervical, the first rib, the thoracic cage. I won't touch the shoulder, and then I begin to do, oh, that's much better.
Can you put that other slide back up again?
There you go. Sure. And that's because all the time, actually, our symptoms are compensations. What troubles you isn't what troubles you. It's almost always something else. So I asked her what was going on. She says, well, I can't, it hurts so much I can't work. But it's kind of stuck like this. I'm going, but it moves. I know. Did you have x-rays? Yeah. MRIs? Yeah. Physical therapy? Yeah. How'd it do? Not good. Look at me. How long? A month. Well, I said, about a year ago. I said, what was going on a year and a half ago, 2 years in life? He says, nothing much. He says, I wasn't working because I was in the hospital. I said, well, why in the hospital? He says, well, my daughter had cancer. She was 11 years old. I said, what was that like? He says, well, she was very particular. She was very frightened. She wouldn't eat unless I fed her. So I spent most of my time in the hospital being with her. And I says, what happened? He says, she didn't make it. And it really tore my heart, she said. I said, so what was that like? He says, I would be there in the hospital, and I would feed her. I said, well, tell me how you feed her. Show me. She says, well, I would hold her like this, and I would feed her because I'm right-handed. With my right hand, I would hold her. And I would talk to her, and I would feed her. And I said, well, you mentioned that pain started shortly after your daughter died, right? Yeah. He says, and it started in the hand that you held to nurture her, to try to keep her alive. But that didn't work, did it? No, you couldn't do it, could you? No, and of course, it's not up to you. You do the best you can. You're a mother, but what else can you do? So I'm saying, do you think there might be a relationship between that left arm that for months held your daughter in a vain attempt to keep her alive, who then died, and the pain you may be having now? And she said, I don't know. I just didn't think about that. But maybe. I'm saying, what I'd like you to do, if you don't mind, I just want you to put attention on that and nothing else. And just know you did all you could. And all you could do is all you ever asked of doing, and nothing else. And then she came back 2 weeks later. She says, I can move it. I'm doing good. I'm doing good. He says, how do you feel about the fact that your daughter died, and you were holding her for months? And she says, I just feel better about it. It still tears me to bits. But I know I did all I could. In the act of forgiving herself, she healed what seemed to be, a biomechanical injury. And that's all it took. I'll share this word here. Let's go right here. Alexithymia, that you saw there on the research. What it means is this. It's not a mental disorder. It's just a personality construct. Tons of people like this. Typically, people who have difficulty connecting to their emotions are not aware of their emotions, or do not connect very well to the emotions of others. They seem to be very logical. Even the dreams are logical. So you might say, well, so what? That's half my family, right? Well, it turns out that, and this is on a sliding scale, almost 9% of the population of the US has this, alexithymia. And the connection between that and health is this. The less you're emotionally aware of what's going on with you and others, the harder it is to respond well to conventional medical therapy, according to research. Your emotions make a difference. Your house of feelings will affect your body and how you feel from whatever's going on. In fact, somewhere in my book, when I remember reading about that, I thought, somewhere in my book I was talking about high blood pressure, and I noted research that shows people with high blood pressure tend to be less conscious of the emotional cues of family members. Less conscious of the emotional cues of family members, which is a trait of alexithymia. Low back pain. How common is that? In our lives we've probably had it at least once. Most of us, right? Statistically speaking. If you have had childhood trauma and undergo low back surgery, the more childhood trauma events you had, the less chance of being successful from low back surgery. If you have low back pain, even in the absence of observable structural pathology, MRIs are fine, X-rays are fine, everything is fine, and it hurts. okay, maybe even disabling. The more unresolved childhood trauma you have, the more often you will have it. And the frequency of low back pain, unrelated to pathology, increases with the frequency of unresolved childhood trauma. So beyond the cells of our body, we have to look at that greater essence of who we are at different levels to really be able to heal and come to a place of deeper health and well-being. I'm taking my time, by the way, going through these because 5 days ago, I just moved from one city to another. And preparing a talk while you're moving in the space of 5 days gave me el susto, right? So, el susto, remember? Fright, fear. It just brought up, you know, because there's not much time. But I love doing this. Now, feel less, heal less. This is an observer scale to measure alexithymia. And here's what they found. You heal less quickly. It takes longer to heal the less you're in contact with your own emotions and the emotions of others. Your inner world counts and makes a difference in your structural physiology. I think it was Socrates actually, 2,500 years ago, who said, unless the whole is healed, no part can truly be healed. Now, of course, that was 2,500 years ago, and he didn't have the modern medicine we have now, right? But let's take a look at that. And let's see how true that might be. The average prescription drug per research has approximately 70 side effects. 70 side effects. Now, approximately 50% of Americans right now have a prescription in their house somewhere. The number of Americans taking 5 or more drugs has doubled in the last 10 years. Now think about that. 70 side effects that are possible. You're taking multiple drugs, start adding it. And then on top of that, add the drug-to-drug interaction possibilities, right? I had a friend of mine who was a pharmacist who went to school with me. You know, he says, well, I didn't want to be a pharmacist anymore. I says, so I asked him, Lou, what's it like? You know, as a pharmacist, you're there. He says, my name is Louis. He says, you know, Lou, he says, let me tell you something. From my point of view, from what we saw, pharmacists should write prescriptions, not doctors. They're not trained for that. This is what we do all day. We're the ones who know what the ruckus are. We're the ones who keep track of all the interactions and the side effects. Let us know what you want the drug to do, and let us prescribe it. That's his point of view, but I thought it was very interesting. And in fact, according to an article in the New England Journal of Medicine, up to 50% of all prescriptions may be unnecessary. Is that a big deal? Well, keep in mind that 80% of all office visits end up in a prescription. Now, how much prescription do Americans go through? Well, you take the globe. It takes 57 people in the globe, their prescriptions, to add up to the annual prescription of each American. That's right. 57 people in the world to just add up to what each one of us is using at a prescription level. Let me leave that one there. All right. Falling burn here with that. So, there's something else that's going on, and it has to do with the number of women that are being prescribed mood-altering drugs. The number is striking. 1 out of every 4 women are right now on mental health drugs. So when you go to the supermarket, when you're sitting at your favorite restaurant, you look around and look at the females there, and they're smiling, they're laughing. Statistically speaking, 1, 2, 3, she's on. 1, 2, 3, she's taking a mental health drug. Every 4th one. It's really astounding. So Think about Socrates. Is he onto something? Should we not worry because we have the benefits of medicine? I think we should be worried. In the United States, when it comes, and not just in the US, but this is worldwide, but the research is done largely in the United States, when it comes to how medicine is practiced, that's also something that we have to keep a close eye on. Because there's some challenges here that make me think of the Sunday paper, the real estate section. And that's the next topic we're going to talk about. Location, location, location. So here's what happens. Some states in the US, per 1,000 people, will prescribe three times more opioid painkillers than other states, for no apparent reason. 3 times. Some teaching hospitals, at least in the research that were done, for knee replacement, back surgery, bypass surgery, will have up to 2 or 3 times more frequent surgeries than other teaching hospitals with no apparent reason for it. If you are going to Canada, your chances of receiving pain-killing medicines for the same problem you're having as opposed to America is approximately 3 times less. If you have low back problems, you're 5 times more likely to be operated in the US than you are in Britain. 5 times more. I don't think the Brits have 5 times better backs than we do. Now, in the summertime and it's August and it's hot and you're exploring the left bank in Paris and you get sick, your chances of being prescribed an antibiotic in France are 3 times greater than you've got the same illness if you were exploring the fjords of Norway. So it's not just here in the US, it's international as well. According to the National Academy of Medicine, 1/3 of healthcare expenditures don't improve the health of patients. Take a look at this picture. What's missing from this picture? It's a trick question, sorry. This picture was taken 30 years ago in 1988. Just a general group of people. There you go. Thank you. That's very observant of you. Congratulations. You get the car, you get the car keys, not the car. We can't afford the car. We're going to give you keys, though. That's just, $20. Yeah. So what you're seeing here is a 1988 picture. Look at the phenotypes. The average American now weighs 24 more pounds than then. So add 24 pounds to each person on this picture, and you'd have the same picture in 2018. Not only that, right now, the obesity rates in the last 10 years have skyrocketed. There's been a significant difference in the last 10 years. Obesity rates right now in America are almost at 40%. Not overweight, obesity, BMI over 30, is 40% in America. Slightly higher for women, slightly lower for men, not by much. Half of all medical research, or half of all medicine, doesn't have research that supports this practice. It is an art, the art of medicine, And there's science involved, but it's an art. So people might say, well, the answer to that is more research. That also has limitations. Down the road here at Stanford University, Professor Ioannidis and others have done research showing that up to 1/3 of all highly cited medical research is either shown to be untrue or contradicted. This is highly cited medical research. JAMA, New England Journal of Medicine. So, can we trust research? Well, as far as we can throw, as far as we can. The U.S. National Institutes of Health have stated that biomedical research system in America is failing. And that was recently. Take a look at this picture. First man on the moon. So the year would be 19... That's right, right? Right? Hot summer. So when Armstrong landed on the moon, his first words were, that's a small step for man, a large leap for mankind. That's right. You get the other car, keys. It was also a large leap for something else. When this was taking place in hospitals throughout the United States, when they were watching this on TV, out of every 100 women that were giving birth, approximately 4 underwent cesarean section. Let's go back to 2000. Now we'll move forward to 2018. Right now, it's almost 30 out of 100. You may say, wait a second, we got better medicine, so they need it. Well, the same research, more than one, shows that solely for medical reasons, only 5 to 10% of women need cesarean sections. You may then say, yeah, but at least they're healthier, right? I mean, look at the great drugs we've got. The maternal mortality rate in 1968 was 9 deaths per 100,000. Guess what it is now? Almost twice as many. That's right. So we've taken a giant leap in some things, and we've gone a giant leap backward as well. In fact, America has the highest maternal mortality rate of any industrialized country. If you're a woman and you get pregnant between that maternal period, you're 3 times more likely to die than you're pregnant in Canada, and 6 times if you're a Scandinavian woman. So, we need to ask ourselves, well, maybe that 2,500-year-old Greek philosopher was onto something. Maybe we have to really examine ourselves. It's not enough of what we're doing. There's a company, there's an organization. This is the U.S. National Institutes of Health slide I was talking about. So this is an organization that may be of interest to a number of you. It's founded by the American Board of Internal Medicine Foundation. Basically, they're a group of medical specialists, and what they do is they work with national organizations. And what they do is they work with these national organizations to provide general guidelines as to, listen, is this used a good time for hysterectomy or not? For an ovectomy or not? For a mastectomy or not? For practically any type of procedure, whether surgical or drug-related, you can go to choosewisely.org and see, well, from a conventional perspective, what information can they give me that I may want to discuss my doctor with? And then make better choices. Sometimes people say, well, you seem to be, pointing a finger, and really I'm not. I'm not talking in an incriminating tone. I'm just pointing out what the defects are, some of them, as well as the obvious benefits. Because we've certainly benefited, and I'm grateful for the advances in medicine in the last 30 years, or 2,500 years since the time of Socrates and Plato. But we need to keep our eyes out and carefully select, cherry pick, what the medical delivery system has to offer, and then not only look at the functional medicine, the herbs, the diet, the exercise, but look at these other factors, these little known connections that are also so important. And you've heard some of those stories I've shared with you, and there's a lot of others like that I've experienced. Look at the other dynamics in your life, mental, physical, and emotional. They may have an impact into your health. We have a tendency, because we have such great science, to go deeper and deeper into the rabbit hole, right? And the microscope gets more and bigger and bigger. And have you noticed, by the way, most visits now to doctors are to specialists. Talk to I work with Stanford medical students, ask them, so many of them go into specializations, right? It's the fastest growing area. Now you have heart specialists that specialize not just in the heart, not just in one side of the heart, but one side of the heart and this one. Oh, the other guy's this, I do just this one. And you know what the definition of a specialist is, right? Someone who knows more and more about less and less. And they're obviously needed, and we're very grateful for them. But we have a tendency to be microscopic in our viewpoint, and we forgot the telescope. We need to take a step back and say, what is my entire body telling me? Not just my cells. Not just the structure. What is the greater self telling the lesser self? What is the unlimited me telling me the limited me that I may need to hear, that I need to know what's going on? So, I mentioned biomechanical. We talked about emotional forgiveness. People carrying somebody else's symptoms. Sometimes these connections are pretty common sense. You guys have seen the ads, right, on TV. Have you eaten 2 cheese pizzas, and it's nighttime, and, take antacid so-and-so, right? Right? And this has been running for years, right? Well, wait a second. What if I don't eat them? Sometimes it's as simple as that, Freud said a cigar is sometimes a cigar. So we have to look at what is the nucleus of action. Is it physical? Is it biochemical? Is it cellular? That's driving whatever pattern or condition we have and address it. And in fact, I suggest you look at all 4 nucleus of actions, because that will give you the greatest chance of having the greatest health in an integrative way. So we use terms like functional medicine and integrative medicine, and they're wonderful. My suggestion is look at functional beingness and integrative beingness, and integrate functional medicine and integrative medicine into that. Sodium is a molecule. Connections, context. So low sodium, high blood pressure. High blood pressure can give you, obviously, kidney issues, right? And you see low sodium diets. There's an industry out there, low sodium soup, etc. But sodium can also be ingested to lower your blood pressure. Sodium can also be used to heal your kidneys. And it's now been given to patients with chronic kidney disease. It's still sodium, but it's the context in which sodium is used. And I found that context is usually resolved by stepping back and looking at the context. So for example, sodium is commonly found, we ingest in table salt. What's a table salt? Well, it's a neutral compound with a positive and negative molecule, right? In this case, sodium chloride. There's different types of salts. The research is showing it's not so much the sodium, but the chloride that's the issue. And in fact, sodium is now being used, that just came out recently, as treatment to help people with autoimmune disease, hypertension, obviously. And they're looking at it in the following way. When you take they've given students for 2 weeks a cup of water with baking soda in it. And what it does is it stimulates the spleen to create, and the spleen is interesting, the spleen in 2 weeks' time actually grows in size. And what it's doing is creating anti-inflammatory macrophages instead of pro-inflammatory ones, M1 versus M2, which go to the gut and go to the entire system of the body and begin to heal it. So what's beginning to happen is, with that taking place, now you no longer have the creation of interleukin-6, tumor necrosis factor alpha, NF-kappa B. And for the guys some of you people are familiar with biologic agents, immunosuppressive agents that are being used now, right? For rheumatoid arthritis, for a lot of autoimmune diseases. What drives that? What are they doing with these biological agents? They're trying to drive down interleukin-6, tumor necrosis factor, NF-kappa B. And something as simple as baking soda may be able to do it. We know there's research showing magnesium does it. So taking magnesium will also help with that. Potassium, potassium is something that we don't eat as much as we used to. And even that is in context. Here's a molecular context. If you take potassium from an animal source, you'll be more acidic. Research is showing that will cause a greater chance of a stroke risk when you're more acidic. If you take it from fruits and vegetables, it's more alkaline. And the research is showing it lowers the stroke risk. Same potassium, but what's it connected to? But why? Because the bicarbonates in the fruits and vegetables will allow that alkaline reaction that brings out acidity. Here's another molecule. You guys recognize it, of course, right? So now let's talk about context, because when you're on high blood pressure, what is one of the drugs they give you? Diuretics. They go out the water out, right? Reduce. It's just basic, physics. Reduce the pressure, reduce the volume, you reduce the pressure. But what's interesting is there's research done showing, and this is the strongest research I've seen so far. I'm sure there's other research out there, but they put people who had high blood pressure, we're talking about 160, 170, 180, under a medically supervised water fast, 11 days. Every single one of them dropped from 180 to 120 to 130. All of them, every single one of them. It's a small study, but fairly well done, quite well done actually. Every single one of them no longer were taking blood pressure medications after.
Did they drink water again?
It was 11 days of medically supervised fast. So, and it was they screened the people to make sure they could handle it, of course, right? So, pros and cons, right, to fasting, but this is what the survey showed. This is what the research showed. So again, it's really, the sense of connection, the sense of context that really determines how something is going to respond for us. They did a study, they went back 30 years, something like 30 years, and they says, okay, we're going to study not just one country, we're going to study 188 countries and see what works to help people lose weight. Fix the body to fix the fat. That's what we're talking about next. Guess how many countries in 33 years? Now listen, we got Oprah, right? We got Dr. So-and-so and Dr. So-and-so and Dr. So-and-so. We got diets out there. We got magazines, I mean, how much information do we now have about great things about, taking better care of ourselves? In 188 countries, none of them experienced a significant reduction in weight loss. Practically the entire planet. So whatever we're doing doesn't seem to be working very well. And obesity is really the #1 cause of so many other problems. I tell people, you want to win the lottery? Lose 40 pounds. But do it healthily. That's your lottery right there. Okay? You'll do more with that than you would with $1 million, especially in the Bay Area. So what I tell people when I see them and they come and listen, doctor, I want to lose a pound. I says, I want to lose 20, I want to lose 50. I says, listen, I can't help you to lose 1 pound. But I'll help you to have a healthier body so you can lose 50. So in our clinic, we have a rule. If you're going to lose weight, you're going to do it without ever going through 1 hour of hunger, always having energy, always sleeping well, and all your systems working well. And this goes back to the connections, because people put diet and exercise first, and we know from research that hasn't been working. So I say, let's make your body healthier. Because if I palpate your intestines as you're lying on the table and you're going, ouch, 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 and I'm going up and down your intestines, and they're hurting, and they're tender, I'm saying, I know research shows, among other things, that intestinal inflammation, dysbiosis, will cause a change in your liver. It'll be more difficult to lose fat and easier to gain fat. And beyond that, we can go into leaky gut, etc. But I'm saying, first, let's make sure you have the energy to be able to want to lose weight, and to be able to lose weight without having headaches, without getting tired, without getting shaky, without getting irritable, and that you're sleeping well. This makes sure your systems of elimination are working well. When, weight loss is traumatic. It's a traumatic event. And I tell people, you're going to release from your fat cells a number of chemicals that have been stored there. Just make sure your body's working well. The ancient Tibetans talked about lack of contentment as one of the principal causes of illness and disease. Lack of contentment as one of the principal causes of illness. That's an important connection. The ancient Greeks, their point of view is when you were ill, you had lost some sort of relationship or harmony between what you were meant to do on this planet, what your life purpose was, and how you were living it. And they suggested correcting that. The ancient Romans worked with dream temples. You would go into these healing temples and you would have dream experiences to be able, through dreams, to be able to help to heal yourself. The world of emotions, the world of our inner feelings, has such a strong effect on our body. Take a look at this. Diabetic wound healing and depression. Diabetics who are depressed heal slower. If you score higher on the geriatric depression scale, you're going to heal slowly. Claudius Galen. For 1500s, he set the tone for medical practice. One of the most famous physicians of all time. He said, to find the cause of all diseases, look first to your dreams. We've lost the art of dreaming. We used to have it in Asian cultures. We've lost it. How did he become a physician? His wealthy father had a dream where he was told, your father needs to become a physician. That's how important and relevant dreams were back then. This is what I do to help myself connect with what's going on in my life. That happens to be, I took that this morning. That's my dream journal. I write dreams every day. Once a month, I check them and say, okay, what are they telling me about me? My illnesses, or my conditions. And sometimes it can just be one dream here, one dream there. Sometimes it helps me in how I'm going to handle life. I want to connect my inner world to my physical world, to my outer world. And in doing so, I've been doing this now for about 30 years. It's made a big difference. Another thing you do is a gratitude journal. Gratitude will make a difference. So will meditation. So will breathing. I have a free meditation class. It's really more a meditation. It's more of a contemplative exercise. And I teach people this technique that I've been using for about 35 years. It's not religious. It's just something that helps people. It's called helpyourlife.org. And there's information on there if you'd like to learn about what has helped a lot of my patients to feel more ease, to see actually healing take place in their body, and to have a greater sense of peace in their hearts. What's the connection between this English physicist, theologian, astronomer, Newton, whirling dervishes? 100 hours. So let's explore those connections. Gratitude and service. Let's talk about service. 100 hours is a magical number for service. How would you guys like to be able to lower your mortality rate by 33%? You know how much a pill that does that would make for a pharmaceutical company? To lower depression rates? To have 1/3 less health issues than others? There's a pill. And it's free. It's a 100-hour pill. This is what research shows. If you do service and the threshold is 100 hours a year, at 100 hours of service a year, the research shows you have 1/3 lower mortality rate, 1/3 lower reported ill health, and less depression. And what's the connection? Let's go back here. Newton. What's his third law of motion? For every action, there's an equal and opposite reaction. You're pushing yourself and doing all you can to get healthy, right? Go help somebody else get healthy. Equal and opposite reaction. Make someone out there feel better. And the universe will return that to you. Whirling dervishes. This dance came about an 800-year-old dance. It's a dance of spiritual unity, a dance of remembrance. And what caught my eye was this. Look at the position of the right hand, look at the position of the left hand. It's like this. So what they do when they dance, they twirl counterclockwise around. And the right arm is like this, and the left is like this. The arm is higher. So what's going on like this, right? What's going on is this. It's beautiful. They are receiving the blessings from heaven, but they know they must return the blessings to earth. They must serve. And in that dance that they do, they become this channel of service and love to others. And that type of tradition, that type of awareness has been going around throughout civilization for thousands and thousands of years. Level of gratitude is a predictor of health status. Be grateful for what you have that's good, but if you're also grateful for what you don't have, now you're twice as grateful, right? The more grateful you can be, the better your health status. That malignant cells, that illness, that pain, instead of doing everything you can to make it go away, it's part of you. You know, cancer cells are you. They're your prodigal sons and daughters. They don't come from out there. They were created inside you. What if you embraced them so hard that you squeeze the life out of them? And in gratitude, they just went, and they transmitted to something else. And do that while you do everything you can, the functional medicine, the exercise, whatever you want to do, you know? But also bring that, incorporate that into you. Because it's what we embrace, it transmutes. You know, the allopathic approach is what? If it's up, you drive it down. If it's down, you drive it up. And we do it chemically. Well, in functional medicine, let's look at it naturally. We got herbs, we got this and that. But you have to be careful of not sticking with the allopathic approach even in functional medicine. You want to approach your health through well-being, not through conflict, through embracing, through transmutation rather than conflict, rather than war. Sugar cube. What's the connection between a sugar cube and what we've been talking about? But we're physical. Doc, look how physical I am. You're talking about emotions, you're talking about, you know, love and gratitude. But what about this? Physics is telling us that we're not as physical as we think we are. You look at yourself in a mirror, you touch, this is a perception. They're mostly space. You line up the 7.5 billion people on this planet, side by side, atoms touching atoms, right by side. And you know how much we form? The size of a sugar cube. That's humanity's sugar cube. That's the physicality right there for the entire planet. And what's the rest of us made of? When we look in the mirror, space, dark matter, 95% of it. The connections between these atoms, the relationships between these atoms, that's what makes us. And that's what is the difference between us and something that is not alive. Rumi, my favorite poet. Wherever else, whatever you do, whatever path you're looking at, whatever signpost you use, I return to this poem myself over and over again. He wrote, this is from Coleman Barks, A Year of Rumi. Forget the nonsense categories of there and here, race and religion and destination, starting points and destination. You are soul and you are love. Not a sprite or an angel or a human being. You're a God-man, woman, God-man, God-woman. You are your own best medicine. Thank you.
We have like, Larry? We have like 1 minute for questions, so who's got one? Any questions? No questions. All right. So, oh, okay.
Bern, sleep apnea raises CO2. Is that CO2? Is that healthy for you?
Sleep apnea actually lowers CO2 function. And what helps with sleep apnea, actually pregnenolone and progesterone and DHEA. They really help in reducing sleep apnea.
All right, so let's thank the speakers for their lectures. Thank you all for coming.